Hi, hiyo, and hiya! Thank you once again for tuning in. My name is Emil Magpantay. I'm your occupational therapist. Today, we are going to talk about the continuum of care. Okay, as I said, we're going to talk about continuum of care. Why is this important? It's really important so that clinicians like yourselves can identify and can trace the pathway in of your service. That's one way. The other reason why it's important to know the continuum of care is that so you would know where the person or where the patient would go through and what are the stages that they follow throughout the healthcare. Okay, so that's why that is important. So there are stages of healthcare, and we are going to talk about that. As I said, there are actually four. Okay, the first stage is called primary care. Well, I'm sure you've heard about primary care before. Others talk about primary care being the GP services, all the outpatient services, them being the primary care. So when I talk about the primary care, I'm not talking about who pays for it, yeah, like the GP or the outpatient services. So primary care basically is health promotion and illness prevention. Yeah, when the government puts up adverts on the telly saying cigarette smoking is dangerous for your health, that is to stop people from having lung cancer so that they don't have to go to the hospital. Or if you say don't drink and drive, this is to promote people, this is to encourage safety and obviously prevent unnecessary and stupid deaths. Or when they say if you think stroke, act fast. Yeah, so these are some of the primary healthcare initiatives of the government. Yeah, so the objective in primary care is to promote health and well-being and to stop people from going to the hospital. Okay, now what are the services that are in primary care? You can have GP services. That's true, because what they will do is that they'll keep the people up in the community for as long as necessary. Yeah, keep the people in the community basically. What else is out there? All the other primary care services out there. Like wellness promotion and weight loss programs. Those people in terms of mental health services that are based in the community. These are all primary care. In terms of health, it comes to those point where when people are, having some crisis at home, but it's not really a health issue. The health admission or health promotion services, or no, admission prevention services. That's what that is. So the admission prevention services, there are services out there, they would name it so differently, like intermediate care, rapid response team, hospital admission prevention team. So these are all primary care services. The objective is to keep people in the community and to stop them from going into the hospital. After the primary care, the next stage is secondary care. Now, secondary care is when somebody, let's say somebody gets sick in the community and that they could not be maintained in the community anymore. What they need to do is to really have access to specialist doctors that they needed. Yeah, they needed to be medically fit and well to control the illness, and they need to have access to diagnostic tools quickly, And such diagnostic tools and equipment may be CT scan, an MRI, and X-ray, for example. So these are the few things that are required. So if they're very much unwell, that they cannot be maintained in the community anymore, what they need to do is people needs to go to the secondary care. Secondary care takes the form of a big general hospital. It is a big, I always say it's a big shopping mall where all the services are there. You can have access to the professionals that you need and the specialization that you need. You know, doctors, general doctors, orthopedic doctors. You can have neurology. On special occasions, spinal cord injury and stroke services are there as well, heart services as well. So there's a lot of services. So a lot of services in these big hospitals. So that is the secondary care, and the main objective is to be medically fit and medically stable, for you to have access to diagnostic equipment, and to be discharged home as soon and as quick and as safe as possible. Yeah, so that is the secondary care. The responsibility of a therapist working in secondary care would be to assess the person based on their day-to-day function, and how to assess how does the condition affect the person's day-to-day functioning. Yeah, that's one, to make an assessment. Two is to discharge the person home as soon and as quick and as safe as possible, to allow people needing these diagnostic beds access, so they to allow people to have access to diagnostic beds. Okay, so it won't be a surprise for therapists, and don't be surprised that if you're a therapist and all you feel you do is discharge planning, because that is the nature of what you do as a clinician. You know, part of what you do as a clinician in a general hospital, you do plan the discharge, but you make sure it's not just the discharge planning. You make sure that the person has been assessed on their day-to-day function. You made sure that the person will be discharged home safely. Okay, and the next responsibility of the therapist is for the therapist to assess or to make recommendations as to where this person would go. Meaning, if you can't go home but you're medically optimized, yeah, then the therapist will have to make recommendations as to where you should go next. And where you should go next is obviously the tertiary care services. Okay, now to go home, there are three functional requirement needed for a person to go home. You know, just three basic things. One, you need to be safe with your functional mobility, meaning you can get on and off the bed on your own. You're not going to fall. You can access a chair just next to you. You should be able to access the toilet facility. You should be able to walk safely and consistently. So that's one. You need to be safe with functional mobility. The second functional requirement needed to go home is for you or for the person to be safe with their toilet hygiene. If the person cannot engage in their toilet hygiene safely, and they wipe their bottom, for example, and they tip over and they fall over, then you cannot go home. Yeah, you're not safe to go home yet. And then the third is for the person to be able to call for help if needed. Yeah, so emergency response. Those are the three requirements that are needed for a person to go home safely. Now, if the person could not do any of these three things, but they are medically optimized, the recommendation of the therapist then would be to transfer this person to an inpatient rehab facility or inpatient convalescence unit or an optimization bed elsewhere. You would name it differently, but basically this is now called the tertiary care service. Yeah, the tertiary care service is a next step out of the general hospital, and the purpose is again to be safe and to enable the person to do the things that are required to get them home safely. So that's the inpatient tertiary care service. Yeah. Okay. Now, for example, if the person is doing all of these three things, they can call for help, they can mobilize within the safe distance, they can engage in their own toilet hygiene safely, they can go home. So that's a good thing. But if based on the initial assessment the therapist or the patient still could not do the basic things that they couldn't do prior to being in the hospital, like for example, they couldn't do their shopping, they couldn't do their cooking, they couldn't fully engage in their washing, showering, and dressing, or do their domestic chores, their performance is at sub-level compared to their performance prior to admission, then you need to have follow-up therapists in the community. And these are also called this is also a tertiary care service, but this time around it's community-based tertiary care service. Yeah, so these are, they would name it differently, they'd call it reablement services, home help services, or rehab from home services. There's many names. They would name it differently in different parts of the county, but at the end of the day the objective is to optimize the person to get them back to the level where they were at. So that is the tertiary care services. Okay, every now and again you would have unfortunate situation where the case is very specialized, like you break the back of your spine, you break your spine, so you have spinal cord injury. That's a very, very unfortunate event. You have, say, burns, you get head injury, or sometimes stroke, but most of the time say head injury. So you get all of these things, for example, and in the olden days, there used to be these kind of units in every general hospital on the secondary care unit. But the problem there is that we could not keep hold, or we could not provide an equitable service to all the hospitals around the country, because the specialization, well, one, the case doesn't happen often, two, there's not enough specialists to do these things, and it's hard to allocate resources like specialty doctors and specialty therapists in there when the case doesn't really happen frequently. So what the government has done is they have developed like specialist centers sparsely located around the country, and these are called specialist units. And when you go to a specialist unit, this is now the quaternary service, yeah, the fourth level. These are the hospitals behind the hospitals, where most of the referrals would come from the general district hospitals, yeah. So that is the quaternary service. You would have head injury units, boom. You will have spinal cord injury unit. You would have burns units. I can't think of any other specialist centers. Amputation centers like that, for example, or you can have military doctors or military hospital. These are all specialty hospitals. So the objective here in these hospitals, so once a person has that a condition that needed that, is the referring hospital, the general hospital, will have to refer the person over to these general hospitals, the quaternary hospitals, and the responsibility of therapists here is to provide that specialist, like intensive specialist service, so that the patient get the service that they need, the therapy that they need, and they can give it up to in as much as 6 months if required. And once the person has received all the therapy input that they needed, then we are hoping that after this, the centers, the specialty centers, will send them back home to the level where they were, either needing full-time care or either needing additional home-based therapy input or some adaptation. So hopefully, once they're done on the quaternary service, everything should have been done. So the responsibility again is to do and to provide all of the services that is required. Now, you have different centers, like for example, specialist heart centers, like say Papworth Hospital, and that's a surgery hospital. So it does look like a general hospital as well, because it's surgery. It's a specialist surgery. So the functional implications of surgery is not as bad as compared to the functional implications of a spinal cord injury or a head injury. And that's why in hospitals like that, like specialist surgical hospitals, they do look like a general hospital as well, but only they cater to specialist surgical procedures. That's so you have to take note of that. So those are the four aspects of continuum, the continuum of care. Again, primary care, which is for health promotion and illness prevention. Secondary care is to address the urgent medical needs, and you need to go home as soon and as quick as possible. Okay, the tertiary care services would have been an inpatient services, where it could be a rehab unit or optimization bed, or it can be a community-based rehab services where you get the therapist coming in to see the person. And then the quaternary service are the specialist centers. Okay, so those, in summary, that's the four stages. Let's talk about some of the confusion and some of the problems. Okay, now the problems lies when on the secondary care service, the therapist and the clinicians would treat the patient as if they were a rehab center. What happens here is that on the secondary care, once they're medically optimized, the person really needed to go home. If you're not sending the person home, it means you are blocking the bed and you're not allowing a flow of emergency cases, and that becomes a problem. So discharge planning is something that we will talk about in this a future talk. Okay, so that's one of the problems. Another problem is that once the person is medically optimized, they really need to get out. But to be transferred to another hospital takes a process of referral from the doctors, or there's a different procedure on how it's done. Different places has got different processes. So you have to be aware of the processes on how you would transfer a patient from a general hospital to an inpatient rehab or optimization bed. Now, if it only takes 2 or 3 days, maybe you can keep them in the hospital for that length of time. But if it will take longer, then you really need to act very quickly, and the discharge planning team in the secondary care facility needed to act very fast. Another problem is on the quaternary service. Once you get to the quaternary service, you've done everything that you can. Sometimes the person cannot be restored back to their full independence or to their previous level of function, and because they're from different parts of the country, it's hard to access the facilities where the person lives. So if the person needs adaptation, for example, it's hard to organize that one. If the person needs follow-up therapists, maybe difficult to organize that as well. So these centers, the quaternary services, sometimes in terms of processes, technically they should refer them back to community-based centers. But it's a practice that's been happening, the quaternary service refer them back to the quaternary service because the quaternary service has a quick and direct access to community hospitals. Yeah, so sometimes there is a direct link between the hospital, the general hospitals, and the community hospitals. There's a direct understanding between the two of them that these community hospitals will cater only to patients coming out of their district hospital. So it's getting hard for quaternary service to access bed on this one. So sometimes it's faster to get the patient from the quaternary service to the secondary because the secondary has access to the tertiary care. You know, it's a little bit confusing. We'll talk about that in discharge planning. So that's it, guys. Thank you so much for listening and for paying attention to the Continuum of Care. Just a point of disclaimer. You know, when I was learning about these things, I really don't believe my teachers. I don't easily believe facts. So that's the same advice that I would give to you. Listen to what I've got to say, but check the facts and learn and find your own truth, okay? It's just to help out, really. So thank you for tuning in. My name is Emil Magpantay. I am your occupational therapist. Cheerio!